In considering going into the nursing profession, there are a few priorities that are crucial to determining future success. When individuals look at all of the criteria, it becomes clear which schools would be a better choice. The first criteria that many people face when going back to school is financial. Some of the factors that need to be considered about the school are, for instance, how much will it cost per credit hour? Cost per credit hour depends on the school, whether or not it is accredited, a community college, a private college, or a four-year university. The other criteria for determining which nursing school to attend is of course whether or not one can obtain financial aid. Financial aid is available for many that are in the working class. There are also federal loans that can be obtained with very low interest rates. It would be considered a wise step to visit the financial aid office of a college or university near one's home to find out about the availability of government funding. The next criterion, which may or may not be important for some, is the vicinity of the nursing school. For many whom work and plan to attend school, the closer the school's location, the easier the commute. In this society of multitasking, the closer that work, home and school are to one another, the better. Also, gas is now a real concern. Driving 50 miles may not have been a deterrent to some a few years ago, but certainly with the cost of fuel nowadays, it has become a real deterrent to many. Along with the school's vicinity, one needs to look at whether or not the nursing school is accredited. If someone is considering obtaining an associate's degree in nursing from a non-accredited nursing school, then if they decide to go on to their bachelor's of nursing, they will find that they cannot continue. The reason for this is due to the following. An accredited Bachelor of Science in Nursing program requires an accredited degreed nursing program from the 2-year associate degreed nurse. What this implies is that the 2 years associate degreed nurse who graduated from a non-accredited nursing school will not be able to transfer in their nursing courses to the 4-year university. This may be a real stumbling block to those nurses who wish to go on for a Bachelor of Science in Nursing. It is also important to know how the nursing school graduates perform on the NCLEX registered trademark, the National Licensure Examination for Registered Nurses. When there is only a 40 or 50% passing rate on schools' national boards, this should raise a red flag for the prospective nursing student. There is no greater disappointment than failing the boards on the first time around. Many hospitals will hire graduate nurses prior to their sitting for the national boards, on the premise that if they fail their national boards, one of two things will take place. 1. Their job as graduate nurse with the hospital will be terminated. 2. They will be demoted to a lesser position with less money. 3. They will be demoted to a lesser position with less money and be offered a second chance with a specified time frame to sit for the national boards once more. None of the previous scenarios is an attractive option to any graduate nurse. Therefore, the percentage of students that pass the boards at a particular school should also be included in the criteria for choosing a particular nursing school. However, do not judge the school too harshly on their rate of students who do or do not pass the national boards. The reason for this is due to the fact that some schools require a high grade point average, such as a 4.0, just to get into the nursing program. This requirement will of course skew the results of passing scores in favor of those with higher grade point averages. These criteria will of course preclude many from even entering the nursing program, since many students are not 4.0 in academics. Generally speaking, an average of 70% and above passing rate on the national nursing boards is a good predictor of the nursing school. But it is up to the individual as to how much time and effort is put into the program as to how much they get out of the program. The nursing programs in general are very physically demanding. time-consuming and mentally challenging. It is a very serious profession, and there are those who find out that the field of nursing is not for them very early in the program. The best advice to those deciding on which nursing school to attend is to use the above-mentioned criteria only as a guide, because it will be up to the individual how well they do in the final analysis.